Good evening, dear friends. Today I will be talking about lifestyle management after a heart attack or after angioplasty. Dealing with cardiac problems is something which is quite common these days, and we all know India is one of the countries where heart-related elements are on rise, and probably we top the chart when it comes to the number of heart patients in the world. We have in fact surpassed our neighbor China in terms of heart-related illness. So naturally, there are many questions from a common man, be it regarding the treatment or be it regarding the things to be done after the heart attack or after an angioplasty. So today I will be trying to address in brief your doubts, or I will probably try to clarify what are the things one has to take care after one goes through a procedure of angioplasty, or one who's been treated by angioplasty after an heart attack or for an heart attack. So there's a common perception that once a person has a heart attack, they always feel demoralized and they feel they wouldn't be able to lead a productive life or an active life following the cardiac event. But that's not the case. It is just a myth. The reality is, the idea of doing angioplasty for a heart attack, the idea itself is to make sure that the heart damage is minimized and to make sure that the given person gets back to his normal routine at the earliest as soon as possible. So let me start in a stepwise manner. So once the angioplasty is done, usually for a heart attack, usually a patient is kept in the hospital for 2 to 3 days if it is a situation without complications. And on average, a patient spends 2 to 3 days in the hospital following a heart attack after an angioplasty. And then we discharge the patient. Then the question arises, how do we manage such patients, or how should patients take care of themselves the moment they go home? First and the foremost thing is, most of the times we advise rest for about 3 to 4 weeks. This is the healing period for any damaged heart. See, heart attack technically means damage to the heart. So it takes 3 to 4 weeks for the heart to heal and bounce back to its optimal activity. So this is the time we ask the patients to take rest. Rest in the terms, what I mean to say is it's more of a mental rest, meaning to say we ask them to keep off their routine work. If someone is employed, yes, we ask them to stay away from work for 3 to 4 weeks, recover, and then we ask them to get back to work. These 3 to 4 weeks, yes, there are instances where people ask us, can we work from home? See, any form of work-related things, be it at home or in the office, it creates mental stress and pressure. So the idea of being not allowing the patient to go to work is simply means it is to avoid mental stress. So working from home or working from office implies that you shouldn't be doing both. This is usually in a straightforward situation or in a regular situation where a person who's had a heart attack after discharge, we suggest them 3 to 4 weeks of rest, and then we ask them to get back to their routine, or when they bounce back to their routine activity in a stepwise manner. And the most common thing is, yes, one should be very clear or very sure that they change their lifestyle. Heart attack, like in many other diseases, or heart cardiac problem, is a lifestyle disorder. So meaning to say, this diseases catches up with a given individual when their lifestyle is bad, be it in the form of lack of exercise or very bad diet or leading a stressful life. So these are the few bad lifestyles which leads to cardiac illness. So we should look at addressing these issues. So the idea of doing this is, it is to prevent these. If you take care of these issues, like changing the way you eat, changing the way you, meaning to say avoiding sedentary lifestyle, meaning giving some time for exercise and doing some activities to reduce stress. So these are the things which will take you a long way in reducing the chances of getting a heart attack again. Because one should remember, once a person has a heart attack, yes, these are the people who have tendency to develop it again if you don't take care. That doesn't mean that one should develop it at any cost. No. If you take care of your lifestyle, make changes in your lifestyle, and if you adhere to the instructions given by your cardiologist, yes, there are very remote chances that you can have one more heart attack again. So, but unfortunately, many times the people neglect this. They refuse to change their lifestyle. They feel like getting treated for cold, like giving an antibiotic for infection, where you take the antibiotic once the cold is gone, one feels that yes, they don't need to do anything. They can lead a company. So this kind of a notion patients have. So once the heart attack is been treated with angioplasty, they feel that the blockage is cleared and they don't stand any chance of getting it again. So this sliding back to the same bad lifestyle again predisposes for the recurrence of the heart attack. So the best way is to, yes, you should change your food styles or eating habits. To put it in simple words, eat food that is rich in fiber, eat food that is low in fat. So this is a simple way out that will take care of your heart, and it will prevent the recurrence of heart attack as well. And exercise. Exercise is something which is a neglected entity in today's world, owing to many reasons. One is lack of inclination towards exercise. Other reason is hectic lifestyle. That is, today's city life or today's urban life is such where people have hardly any time for any of their personal activities. So in the process, exercise gets neglected and they hardly tend to exercise. One should remember, anyone's career can progress provided they are healthy. And to remain healthy, yes, you should exercise. At least half an hour of moderate exercise. It can be simple walk, or it can be a moderate intensity walk, or it can be brisk walk, or if you have inclination for other sports activity like swimming, yoga, yes, this also will add to it. So any exercise of any form, moderate intensity is more than enough. Half an hour a day, at least 5 days a week, if you can do it. If you can do it every day, it's well and good. At least make sure one should stick to at least five days a week. That is the bare minimum. If you can do it every day, that's well and good. One should stick to this kind of an exercise regime on a regular basis and on a daily basis if possible. That also prevents a person from having a recurrent episode of a cardiac event. Third thing is the stress management. Yes, most of the diseases what we come across today, be it hypertension, diabetes, or cardiac diseases, they're all linked to stress. So most of that is practically, except infectious diseases. In fact, infectious diseases also are indirectly related to stress, because stress brings down your immunity and predisposes to infection. So one should address at handling the stress. If the stress is at work, yes, there are ways to address stress. The simple way to address stress is you exercise. Exercise is the best stress buster. If you have time, or if you are inclined towards things like meditation, yes, that will add an extra mile to your heart, and it will reduce stress. So make sure that you do your best to reduce stress, be it related to work or in your personal life. Not if you cannot reduce it completely, at least make an effort. Yes, that I am sure that is going to help your heart as well. So these are the few things we advise on a routine when a patient goes home after a heart attack. And second thing, another thing one should remember is hypertension and diabetes are the most common things we come across in a patient who's had a heart attack. Invariably, I would say every alternate patient, or at least more than 70% of the patients who have a cardiac event, either they tend to be hypertensive or diabetics, one of the two, or both. So these are the two risk factors for an heart-related problems, that is hypertension and diabetes. So one should make sure that they address in controlling these elements. Hypertension, if the person is an hypertensive, one should make sure that his or her blood pressure is well under control. If it is not under control, yes, you should contact your physician or your cardiologist and make sure that drugs are titrated in such a way that the hypertension is well under control. And if one is a diabetic, yes, diabetes control also is equally important in preventing further recurrence of blockages in the heart. So hypertension and diabetes control, again, the same lifestyle also will help, like eating low fat diet and high fiber diet will not only brings down the blood pressure, it also helps in bringing down the diabetes, the blood sugar levels as well. And exercise has a multifold benefit in addressing not only your cardiac problem, it also helps in addressing in controlling your diabetes as well as hypertension. So any comorbid factors like hypertension, diabetes, or even for that matter obesity, many of our patients who come up with cardiac events are the ones who are obese, means overweight. So following a strict diet regime, again this strict diet regime will address not only obesity, it will address the recurrence of cardiac events, it will also address treatment of hypertension and diabetes. So primarily what all lifestyle changes you make for prevention of recurrence of a cardiac event, eventually that will benefit your other comorbid factors or other elements which is there in a given person. So eventually, at the end of 3 to 4 weeks, most of the time, most of the patients, at least 99% of the patients will be in a position to get back to their work, and over a period of another 3-4 weeks, most of them will be able to get back to their full activity to the extent of what they were leading before the cardiac event. So to summarize in brief, cardiac event definitely is a major event, no doubt. I would put it as a rebirth in many instances, or most of the instances. But that shouldn't be a reason for anyone to get demoralized. Yes, your prime focus should be on dealing with your lifestyle and your meaning to say your lifestyle and proper control of your risk factors like diabetes and hypertension. Taking care of your lifestyle and treating your other risk factors, yes, will prevent recurrence of the heart attack in future, and you will be able to lead a normal and a very productive life, which one would be leading before a cardiac event. Thank you.
Yes, questions.
So there are some questions. I'll try to answer these questions, which are So one question is, what are the risks? Prashant Sudhakar has asked, what are the risk factors for the heart attack? I just mentioned the prime risk factors for heart attack is, yes, it is diabetes and hypertension. They're the prime risk factors. The third factor I forgot to make a mention is smoking. Today, smoking has become a style statement for many. Many don't realize that it can puff up their life as well. So the main risk factors, what we come across in our country is, one is diabetes, second is hypertension, and third is smoking. So these are the main top risk factors for an individual to have chances of getting a cardiac event. And strong family history also is another thing. Genetics, we all know that genetics is linked to practically most of the diseases. So any strong family history of cardiac related element in the family, yes, such individuals also should be careful and get their cardiac checkup done on regular basis to prevent things coming as a surprise. So another question is, how will I know that in future I will get a heart attack? I just now mentioned, if you are a diabetic, if you are a hypertensive, and if you are a smoker, and if you have strong family history of heart-related elements in your family, yes, you are. That means to say, clearly means to say, you are at the risk, and a periodic checkup would be the simple way of preventing you from getting a heart attack. So every year, at least once a year, make sure that you get your lipid profile. That is your lipid profile check. That is your cholesterol levels. Get your echocardiogram and a treadmill test. So these are the simple tests which will help in diagnosing or ruling out cardiac related element. If it is there, it can be diagnosed well in advance. If it is not there, yes, it makes sense getting it done every year on a periodic basis, at least once a year. Those people at risk and those who are above 35, earlier we used to say 40 and above, now we have come back in terms of the cutoff age, 35 and above. Even though if you don't have any risk factors, it would be still sensible to get your cardiac checkup done at least once a year. So another question is, what are the medications which are generally prescribed after a heart attack? Following a heart attack, there are some standard drugs practically all patients receive. The patient will be on a blood thinner, usually it's an aspirin. There's a mandatory. Also in patients who have undergone an angioplasty, which the drug may be clopidogrel. There are many other blood thinners also. The commonly used drug is, second drug is clopidogrel. So in the first year after the angioplasty, usually we make sure that the patient is on 2 blood thinners. 1 year after the angioplasty, in some instances, there is many times there is an option that we can reduce the blood thinner to 1. But first year after the angioplasty, yes, it is mandatory to have 2 blood thinners at any given point of time in the first year after the angioplasty. And another common drug are the drug which is commonly used in patients after an heart attack is statins, what we call as cholesterol lowering drugs. So we all know that the blockages what happen inside the heart is because of the cholesterol deposits. So to reduce the cholesterol levels also prevents recurrence of heart attacks in future. It not only prevents recurrence of heart attack in future, it also prevents the stent whatever has been put in a given patient from getting blocked. So cholesterol lowering drugs is another common thing, which is common drug which is used in any patient who undergoes an angioplasty following a heart attack. So a blood thinner and a cholesterol lowering drugs are the 2 drugs which is mandatory for any patient following a heart attack and who undergoes an angioplasty. And in addition to this, yes, if a person is a diabetic, he will end up receiving his drugs for diabetes. If a person is hypertensive, he will end up receiving medications for hypertension as well. So what is the interesting question? What is your opinion on e-cigarettes? This is a very interesting question. Many are of the opinion that e-cigarettes are safer compared to the regular cigarettes. If some of you have followed the US FDA warning recently issued last year, they rate even e-cigarettes. US FDA is the agency which cautions the public in US about the safety of a given food or given product. So e-cigarettes also has been listed under the regular cigarettes when it comes to predisposing an individual to an heart-related element. So e-cigarettes pose equal danger like a regular cigarette if it is used by anyone. So let there not be a notion that e-cigarettes are safer and one can kick the habit of regular cigarette and switch over to e-cigarettes. No, it's another form of evil. That's the only difference. Cigarette is one evil and you are switching over to e-cigarettes, you are inviting another evil. So e-cigarettes also is as dangerous for the heart when compared to the regular cigarettes. So both are equally dangerous. I would recommend not to use either of them. Keto diet affects the heart muscle. See, keto diet is something which is yet to be recommended routinely for rehabilitation of a cardiac patient. There are a lot of diet. One is keto diet, and there is another diet called Mediterranean diet, which has also been recommended by many. But if you strictly follow the guidelines issued by the authorities for rehabilitation of a cardiac patient, the simple yardstick is, yes, have any food that is low in carbohydrate, high in protein, low in fat. This is a simple and a straightforward answer to this question rather than confusing you with too many diets. Consume anything that is low in carbohydrate because carbohydrates are the one which will increase your weight, and weight increase also will translate to diseases like heart-related elements, diabetes and hypertension. And carbohydrates also tend to increase your blood sugar. So stay away from carbohydrates, have a protein and low-fat diet. So that should be the mainstream diet for anyone. And high-fiber diet. So high-fiber, high-protein, low-fat and low-carbohydrate. Rather than going for keto diet or Mediterranean diet, these are all confusing, and there are a lot of many times vested commercial interest also in pushing this kind of diet. So one should follow what is scientifically recommended rather than going by the glamour of a particular dietary regime. So I would say stick to low carbohydrate and low fat, high fiber and high protein diet. That should be the diet for any given cardiac patient. So thanks for your attention in this topic. Thank you very much.
Sir,